it worked really well the first time. So here goes. If you've had to go all the way over to Springfield for emergency service, raise your right hand. Okay. If you've had to wait months on end for an appointment to see a healthcare provider, raise your left hand. Other left. Okay, good. If you are simply worried about access to healthcare in general, I want you to put both hands in the air and wave them like you just don't care. All right. I got to say, I go to church here, and I love when my pastor sees that I can get folks to put their hands up like that. We do have an update from McKenzie-Willamette Medical Center. You remember they were here at the last time, said that they were going to work on getting us an emergency room here in Eugene. They were unable to join us today, but they did provide a written statement. McKenzie-Willamette Medical Center has submitted a waiver to the state and is currently in the envisioning and design phase of the satellite ER project. We continue to assess the viability of the facility in Eugene and will provide updates. We're going to be moving at a very fast pace today. The panelists have been encouraged to keep their statements brief so we can spend most of our time taking questions from the community. So here to deliver opening remarks is Eugene Mayor Karen Knutson. Welcome, Madam Mayor.
Thank you so much, JoAnna. Hi, everyone. It's great to be here. Hello, yes, please. Hello, good afternoon. It's great to see you all. And it is wonderful to be here today for what I will call the second annual Citywide Healthcare Forum. See how we just escalated this there into an annual event. Thank you, JoAnna, so many partners, certainly to the Churchill area neighbors for making today possible. I am your mayor, Karen Knutson. I was here with you last year. Thank you so much. Was here with you last year for the first of these forums, and I know everyone here who is in this room and is watching or Zooming or following along later appreciates how important it is to have access to direct, informative conversations like this one today about issues as important to our community as the reliability and quality of our healthcare and access to that healthcare. Looking around right now, it is pretty clear that the silos that we are each living in different ways, especially through the digital world that we can all interact with through social media, are leading to a lot of suffering and a lot of misunderstanding and not a lot of good quality information sharing. I'll just say that as a general statement. So I really want to appreciate the fact that we have the opportunity for a conversation like this one with a panel of people who have deep expertise and great information to share with us, and that we all can gather that information together at the same time and then have an informed conversation about our options and how we want to move forward as a community. At moments like this, I can also tell you that I wish the challenges we were facing as a community were easier. And I know that we will build muscles and we will be stronger for the ways in which we respond to these challenges. And I can commit to you that we will be finding new ways to work together and that we are going to chart a future for our community that is more connected, more compassionate, more equitable, and healthier by every definition of the word. That is the work that is before us. So thank you again to our panelists today. We so appreciate you taking the time to be here with us. We are fortunate to have also several other state legislators beyond the people who are on this stage today and a national congressional delegation who care deeply about access to health care and about maintaining funding for health care and who are working with us in different ways to support those efforts. Certainly Representative Nathanson and all of the work that she's done to maintain access locally and support access to health care services locally. Incredibly important work, as the work of Representative Hoyle and Senators Merkley and Wyden just this week. Some very large, important conversations that are ongoing right now, and I would encourage you to make your voice a part of those conversations, even to just simply state clearly that you care deeply about access to reliable, quality health care in your community, for yourself, for your family, but for everyone else who is within this community with us. Finally, and welcome everyone, I want to follow through on what JoAnna asked me to do, which is share just a few thoughts about why this work is so important. I am not a doctor. I am a licensed architect in the state of Oregon, and I study cities, including how cities can be designed to support health and equity through the decisions that we make every day about our built environment. Those decisions can be as simple as ensuring that people have walkable access to a nearby park where they might play or exercise regularly, or as integrated as making sure that people have access to transportation networks that allow them to reach their healthcare providers and places where healthcare services are available to them. All of this work together supports individual health and happiness, but also better health outcomes for our entire community. Ensuring reliable, trusted access to quality health care for all of our community members is a social determinant of public health. It is one of the things that tells us about how it is that we collectively will do better and live healthier lives. Reliable access to health care leads to more early detection and prevention of disease or complex medical needs. It allows for better treatment of chronic conditions. It means that we have emergency care that is literally life-saving, and also access to infant and maternal health care that changes lives from the very beginning. The work of public health, how we understand how we all together are doing and what we can do to better protect and improve our health, is enormously complex. It operates at systemic and structural and individual levels. And like other complex ecosystems delivering critical services, it can be easily damaged when not addressed thoughtfully, and it is also difficult to repair. Complex systems are challenging. Breaking them is easy. Making people angry is easy. But building things that support people is harder. Helping people can be challenging, but that is the work that's before us. Jensina also asked me in closing if you could share some hope. And what I will share with you is a thought about hope and what it means for our community right now, especially related to this issue, but related to many others. And that is that hope is not a feeling or a thought that it's just going to be fine and we don't have to worry, but it is a decision. It is more of a verb than a description of a state of mind, and it requires us to use our muscles, to participate, to engage, and to thoughtfully, and with as much collaborative energy as possible, think about how we might adapt and improve upon the circumstance we currently find ourselves in. So I truly, absolutely want to thank all of you for being with us here today. I want to thank you for being willing to exercise those muscles, to think about how it is that we can be more actively hopeful in this work. And I want to especially thank our expert stakeholders for the information that they will share. And I look forward to doing this work with you, to continuing this work, and to the conversation today. Thank you so much.
Thank you, Mayor. I'm going to have the panelists introduce themselves to you. Our Eugene Springfield Fire Chief was unable to make it today, so we have somebody who has very graciously volunteered to step in and fill that spot for us. Panelists, you have 5 minutes each to make your opening statements, and there is a timer counting down. It's not on the screen, it's on my watch, so it's up to me to do that. I will give you a 30-second warning, and I may rudely cut off your microphone if you're still going at that 5-minute mark. Eve Gray, kick us off.
There we go. I'm Eve Gray, Director of Health and Human Services. I use she, her pronouns. And I was asked to give a little introduction today about some work that I partnered in an advisory capacity, but was led by Representative Nathanson and Senator Przanski and supported by the remainder of our legislative delegation in the 2024 session. This was House Bill 4136. And this bill was created when because the emergency department was lost in the city of Eugene through a closure. And in thinking about what could we do as a community in order to make sure that we were providing access to both emergency room care, but also other types of care for when people don't need to end up in the emergency room, That was really what House Bill 4136 was about. So it allocated $3.2 million in an innovation fund. There were some other parts of the bill as well, which I don't have time to go into today, but the focus that I will have is on the innovation fund, which has funded 5 projects in our community with the intent of identifying hopefully effective ways to divert people from the emergency department into other types of care. The 5 organizations that were funded include Best Med Urgent Care. So if you're not aware, their Coburg Road location is now open until 10 p.m., 7 days a week. And they do have imaging most of the time until 9 or 9:30 p.m., which is a great increased access. They're seeing increases in volumes as well. So folks, the word is starting to get out. Oregon Telemed also received a grant, and they are a part of Cascade Medical Associates. They are offering telehealth. Initially, it was for emergency department follow-up appointments to help prevent folks from going back into the emergency department if things weren't going as expected after they left. But they are expanding the referrals that they are now taking. So if anyone in this room or anyone watching is in need of telehealth care, Oregon Telemed is an option 7 days a week in our community. Eugene Springfield Fire, which I won't go into a whole lot because I think Chief Kamppi's going to cover that, was another recipient along with Peace Health as a partner. Lane County was a recipient of a grant to expand access to mobile healthcare services for the unhoused population. We've started with 2 shelters. One is the Navigation Center that was started by a partnership between Lane County and the city of Eugene and is run by an organization called Equitable Social Solutions. So we go there once a week to provide primary care services to people who are in shelter. And then we also go to the Highway 99 shelter run by St. Vincent de Paul, really trying to provide access out there in the community to folks who might not have any other options or have a lot of difficulty making appointments, so maybe left calling for an ambulance. And the 5th awardee was Whitebird. They have started a crisis counseling service, 12 hours a day or so, 7 days a week, for folks who need some additional stabilization after CAHOOTS comes into interaction with them. So those are the 5 projects in House Bill 4136, and I look forward to hearing your questions about anything and everything in a little bit. Thank you.
Thank you, Director Gray. I just realized I lied to the panelists. I told them they had 5 minutes. Our agenda actually gave them 7 minutes, but because we have a lot of written questions, I'm actually going to hold you guys to the 5 minutes so you don't get those 2 minutes back, guys. Battalion Chief Kamppi, thank you for being a ringer for us today. Tell us what Eugene Springfield Fire is doing for healthcare here.
You bet. Hopefully this will work. I'm JoAnna Kamppi. I'm the EMS Chief for Eugene Springfield Fire Department, and we are participating with House Bill 4136 in 2 separate ways. One is we received funding for 12 hours of basic life support ambulance service, 7 days a week, in which we added an additional ambulance during that time period, staffed with 2 EMTs to be able to respond. Part of the closure that we experienced was the increase in travel time of taking patients from the West Eugene area all the way to Springfield. And then we, of course, have also experienced increased wall time of not being able to get our ambulances back in service based on the capacity of the emergency department. The second thing that was funded, which was through the innovation grant, was a alternative response unit. That unit is currently being staffed with 2 paramedics, and our hope is that that will be staffed with an advanced provider of a PA, a physician associate, or a nurse practitioner that will be able to respond more like what you think of as I call it, the Dr. Baker model of the Little House on the Prairie, of where you get sick and the doctor comes to you. And our hope is that we'll be able to prove that we don't have to send an ambulance to every call for a patient or a fire engine, which can be very costly, but that we can do this at a lower cost model of being able to bring services to patients to where we can then either direct them to an urgent care, a brick and mortar facility, or we can handle their crisis in the moment. Most of these patients are low-level calls. It is not a chest pain call or a stroke call. This is a patient that may be struggling with an issue that has crept up over the course of a couple of days. Maybe they have a toothache, maybe they are experiencing flu-like symptoms, but they need help, and they're typically, the only way that they might be able to receive services would be through an emergency department or an urgent care. Our goal really is to try to stay out of brick and mortar facilities with this, but at this point in time, without that advanced provider, which we're working with Peace Health to staff that, this is a partnership with them. That advanced provider will come through Peace Health. They have hired that position, and we expect that that PA will start in the field the first part of April. So this is a model that we're hoping to be able to prove that there is a difference of what we can do that is a lower cost model than sending paramedics to every call in an ambulance or a fire engine for these types of 911 responses. Thank you.
Thank you, Battalion Chief Kamppi. I'm going to take a moment to tell a story because some of you may know I'm married to the president of the NAACP. As a wife and as the mother of his children, I get really cranky sometimes when NAACP needs his time and he's spending time with them and not with us, and I tend to be not very sporting about expressing my displeasure. So at a Volunteers in Medicine event, I saw somebody talking to my husband again about NAACP stuff, and I had it. And I marched up to the guy and I said, you know what, you guys really need to give my husband a break. He needs to spend time with his family too. And my husband elbowed me and he goes, that's the senator. Senator Manning.
Thank you. Thank you. Are we on? Yes. My name is James Ivory Manning, Jr. I am the state senator from Senate District 7. Senate District 7 includes northwest Eugene over to the beautiful city and town of Bonita and Elmira. I'm in my second consecutive term in the Senate. I was appointed in 2016. I ran for election in 2018, got elected with 98.8% of the vote. I ran again in 22, got reelected with 76, I believe, percent of the vote. I'm in my third consecutive term as Senate President Pro Tem. The first time I ran, it was along a party line vote. The second and third time, which was this time, I was elected by the Senate unanimously. So my colleagues understand that I am someone that's there not for political gains or anything like that. I believe that all Oregonians deserve health care. I believe that all women deserve access to the full spectrum of reproductive health care, and no one should come in between that, and those decisions are made by the woman and their physician, not by somebody else. So my last overseas assignment, I'm a retired United States Army, 24 years active duty, and my last overseas assignment, I was a senior enlisted liaison to the Australia-New Zealand Defense Force. So I spent a lot of time in the Southern Hemisphere observing the culture, observing the healthcare systems that they have in place, and big takeaways. A lot of things that here in the United States, we talk about being the most advanced nation on the face of the planet. I will say that that's not necessarily true in all cases. For example, let's just briefly talk about solar panels on homes. I was there in Australia 02 to 05. The house that I leased over there had solar panels on. So those solar panels had been on there a long time, no issues or anything like that. Eating healthy, universal health care. Let me bring that one. Preventative health care measures, outcomes, are a goal. If we can help people learn to eat healthy, to make sure that they're taking care of their things like diabetes, managing all those other health-related costs, our medical costs in America would go down extraordinarily low. And we can get there. There is hope. For the last 7 years, I worked on a universal health care bill. And some of my colleagues said that, James, it's a good bill, but you know it's not going to go anyplace. And I love a good challenge. So I was persistent. And after 7 years, first we came up with Senate Bill 770, which is the Universal Health Care Task Force. That task force was an amazing group of people from all parts. We had medical practitioners. We had everyday people. We had advocates. We had culturally specific organizations. We had people from Eastern Oregon all over to chime in on what a universal healthcare system would look like here in the state of Oregon. California tried it. Washington State tried it, and they were unsuccessful, or they only got bits and pieces of it. I was determined that Oregon is going to get the full thing. So we started off, and the people in Oregon agreed. Health care is a human right. Former Representative Mitch Greenlick, before he passed, the bill came back around, and Mitch came to me, and we talked. And I said, the bill was on the Senate side. And Mitch said to me, he said, James, he said, can you get this bill done? And I said, Mitch, for you, I'll get the bill done. After we passed that bill, I went over to the House, and I sat next to Mitch. And I said, Mitch, we got your bill done. Shortly after that, sometime after that, Mitch Greenlick passed away. Goes to show you that there are some people that will go to the mat, all the way to the death, to ensure that we're doing the right thing by the people. Mitch Greenlick is one of those people. I thank him, grateful for his work, perseverance, and everything else that he's done. So now we have moved under Senate Bill 1089. That was a battle. Nothing in the Senate is easy. But through perseverance, we now have an appointed Universal Healthcare Governance Board. There was opposition to saying that we want to keep government out of your health care. I agree. I agree. So the Universal Healthcare Governance Board is not housed under the Oregon Health Authority, but is housed under the DCBS, because now it's turning it into an insurance program. If you remember the Affordable Care Act, it is an insurance program. This is an insurance program, and we have an amazing board that's set up to take this thing across the finish line. That's going to require more funding. I would like to have your voices in support of getting that funding, because I'm looking at, they're hovering something like maybe 1.5 million. I'm thinking about 3 million in order for them just to get the work done. So I'm going to need your voices when this bill goes to Ways and Means. I need you to flood the system. I need you to come up when they have the lobby days to argue for that, to lobby for that, because only until we can set this up where we can reduce the cost of drugs in here, the bill will have dental will be covered, vision will be covered. All those other things that you pay extra for will be covered up under this plan. That's why it would be called a universal health plan, and your prescriptions will go down immensely. So stand with me, stand up for it. Healthcare is a human right. Thank you very much.
Thank you, Senator Manning. He told me he was only going to take 3 minutes. I think he's getting me back now for yelling at him when I first met him. I don't have a great story like that about Amy Fellows, because I learned my lesson, and now I no longer yell at complete strangers. Amy.
Hi, can you hear me? Okay. the senator helped me reduce some of mine, so thank you. I'm Amy Fellows. I grew up here in Eugene, and my why for applying to be on the Universal Health Plan Governance Board was to make sure that somebody involved had a disability justice lens. So as we create this new model for Oregon, we are making sure that we support our most vulnerable Oregonians with complex health needs. I am the only board member with a family member on Oregon Health Plan through Developmental Disability Services, thanks to the Affordable Care Act. And I purchased my own insurance via the exchange. So the Universal Health Plan Governance Board has 9 volunteer members at this point, we appointed by the governor and approved by the legislature, which is comprised of healthcare representatives and public engagement representatives. I'm on as a public engagement representative. Our deliverables on the board, by September 2026, we are to design a comprehensive plan to finance and administer a universal health plan that is responsive to the needs and expectations of the residents of the state. To consider certain values and principles as part of that plan, and to include a plan to create a universal health plan trust fund in the state treasury and a public corporation to administer it. The stage that we're at now is that we started meeting last April 2024. We have 4 committees we did widespread recruitment for. We had 166 applications and 47 people, members of the community in Oregon, were appointed. The first one, or one of them, is the Community Engagement and Communications Committee. I am a co-chair on that committee, and JoAnna, our host, is one of the members of our committee. The purpose of that committee is to engage members of specific interest groups in the board's work. So, for example, small and large businesses, healthcare providers, and organizations, tribes, and community members. So that's our direction from Senate Bill 1089. And also to create a messaging strategy and materials to inform the public about our work. Another committee is the Plan, Design, and Expenditures Committee, which Eve Gray is a member of. The purpose of that committee is to look at create benefits, eligibility, provider reimbursements, and cost containment strategies for the new plan, to create a financing model and actuarial analysis of plan options that include expenditures and savings. Then we have the Finance and Revenue Committee, which Charlie Swanson, raise your hand. Charlie Swanson is on, and he was also a member of the task force that Senator Manning talked about and is active in Healthcare for All Oregon, Lane County chapter. And I want to give a shout out to all the Healthcare for All Oregon folks here and across the state, because it's really because of your advocacy that our board exists. And thank you, and please continue your work. Then we have an operations committee. They started a little bit later to create a plan for an independent public corporation, to design operational plans including organizational structure, staffing, facilities, and information technology needs, to have recommendations on statutory authority, plan to create a trust fund in the state treasury, and create guidance on obtaining federal waivers. And then later, not yet started, there will be a transition committee. The transition timeline and steps that are needed for the implementation of the plan to make it into reality, report on the effect of other state programs and steps that are needed for transition, and to develop implementation strategies, including workforce challenges. So that kind of gives you an idea of where we currently are, and I'll pass it on to Valdez.
Thank you, Amy. So when we were talking about putting on the second healthcare forum, I was told that getting Valdez Bravo is a must. I have no idea who this guy is, actually. I've only just met him a few minutes ago, so I hope he's really, really cool.
Thank you so much, JoAnna. I think you're pretty cool. Hello, everybody. My name is Valdez Bravo. I use he, him, his pronouns, and I have the privilege and honor of serving as president of Healthcare for All Oregon, A 50, hey, right there. A 501c3 nonprofit dedicated to creating a universal healthcare system here in Oregon, and we hope beyond, because Oregon has a tendency to do big things, and then other people kind of pay attention and follow suit. By day, I have the honor of serving as the Deputy Director of the Multnomah County Health Department up in Portland, but today I'm just speaking with my Healthcare for All Oregon hat on. So, one time I heard a local leader comment that the insurance industry just might be the only business that profits when they don't service the customer, right? If you went to a restaurant and you paid for the food and they didn't give it to you, they'd probably go out of business. If you took your car to a shop and you paid them the money and they didn't service you, they'd probably go out of business. But that's how actually how insurance companies make money, is when they don't give you the service that you're paying for. So we at Healthcare for All Oregon kind of see things differently. I'm going to share you a little bit of our perspective. Well, first and foremost, and I think it's been mentioned several times here, and I can see that some people agree with us on the shirts there, healthcare is a human right. Raise your hand if you think healthcare is a human right. All right. And, anytime that healthcare is in the hands of for-profit insurance companies, we're going to continue to see these barriers to care. We're going to continue to see the delays and the denials. We're going to see the persistent poor outcomes and the persistent health inequities from the perverse incentives that basically structurally exist in that kind of profit-motivated healthcare insurance payment delivery system. And think about it, whether you have good insurance or bad insurance, and most of the time it's your employer who picks what kind of insurance plans you have available to you for a good chunk of the population in America, your insurance is in the hands of the lowest bidder. Think about that. Who's saying that they can do it for the least amount of money? And how do you think they're able to do that? Because those deductibles go up, because the copays are high, because you got the caps, because you got the exclusions, because you got the in-work and the out network, and you basically need like it's like a jigsaw puzzle, just trying to find out how and where you can get care in this crazy fragmented system that is healthcare in America. Anytime that you have, and I'm quoting my friend and former HCAO board member Lou Siniger here, anytime you introduce a payment mechanism at the point of care, you are introducing a barrier to care. So whether it's a copay or a deductible or something, every time somebody has to sit there and think, is it worth it to call the doctor for this? Is it worth it for me to go into the clinic to get this care? How many people here have driven themselves or driven a family member to the hospital because you were afraid of how much that ambulance bill was going to cost? Now, maybe that's a little bit different here in Lane County because we got our good old fire department doing it. But up there in Portland, I can assure you that is a big conversation. One time I had to make that. Daughter had a dairy an anaphylactic allergy. I called the 911. But that's a choice that people have to make. And then you see these, first you get the this is not a bill, this is not a bill. Then you get the bill and it's like, oh my gosh, I thought I had insurance. What is going on and why is it? Now we know why it's persisting, because here in America, we have the corrupting power of big money in politics, and the health insurance industry is large. And there's a reason why in America sometimes good policy doesn't happen. But we're working to make it happen here in Oregon. So the thing that we need to do is, rather than keep futzing around with Band-Aids and tweaks and fixes and these kind of things here and relying on transparency, because there's only so much shame that a corporation is, it doesn't really hold a lot with them. The only way we're going to be able to change this is if we change the construct itself. We have to get rid of this model where if I go to the doctor, if I have a need for care, and a doctor, nurse, technician, or therapist knows what kind of care I need, that we have to ask somebody else for permission for that to happen, right? Right? So we need to get insurance companies out of the healthcare processes and just have it back to, if we come up with the universal health plan, there'll be a plan, you will have a need, you will have access to care, and that's it. And it's going to be clinically indicated upon what you actually need. If you're asking how are we going to pay for it, what would this cost? That's the reason the Universal Health Plan Governance Board is doing the good work it's doing across these different committees. But I can assure you, my friends, with America paying 18 cents, and now it's closer to 19 and 20 cents of every dollar in America going towards health care, paying the most for health care of all the countries in the world, but despite having some of the lowest outcomes because there's so much waste and middlemen and insurance and profit motive in the process here in America. If we can get insurance out of it and change the construct and change it to a universal health plan system, here in Oregon, we could cover every single person in Oregon and save $800 million. That's based on recommendations. That's based on early recommendations from that Joint Task Force on Universal Healthcare that Senator Manning created, but that's where the actuarial finance committee and the actuarials are happening right now. Because the thing is, my friends, the money is all in the system. It's just going to the wrong places at the right times for the wrong reasons. Wrong times and right reasons. So I'm going to tell you more about how to get involved with Healthcare for Oregon a little bit later, maybe in our closing sections after our Q&A. But I want to thank you for being here, because the fact that you're paying attention, the fact that you're spending your valuable time on one of the first beautiful Saturdays of the year by coming to this forum and participating in the conversation, this is how it all starts, and this is how the momentum that the Universal Health Plan and our elected leaders that are fighting for health equity make it happen. Thank you.
All right. Valdez, you can stay. One of the very few complaints I received about the first healthcare forum was that we didn't have a nurse on the panel. So, y'all, we got you a nurse. Matt Calzia, please explain to us your street cred.
Thank you. First, I want to say Eve's a nurse. So, Eve Gray is a registered nurse, so I'm honored to be up here with all of you. And I was on the stage once before. It was actually when I graduated from LCC's nursing program and got my associate's degree in nursing. We had our ceremony here. So I was asked to come and kind of present what's happening with the frontline nurses, and also I worked for the Oregon Nurses Association as a director when we got legislation passed establishing nurse-to-patient ratios in Oregon. And it was the, thank you. It's actually the first law in the country where that was established in statute. California had it through administrative rule, but we actually put it in law, in statute, and it is a landmark law. And the need for this is because nurses have to organize and then legislate, because we don't get a voice at the boards of directors. They will say, nursing, if they get ratios, then we're going to back up the EDs, and you're not going to have access to care, but then they don't give us a seat on the board of directors. If we're that important, we need to be on that seat. We need to be there making the decisions, and our voice needs to be heard. We didn't become nurses just to provide safe care. A lot of the healthcare industry tries to reduce things to the bar of safe. I became a nurse to provide really high quality, comprehensive care in a very individual way and holistically. And the industry does not allow us to do that. So we have to go and we have to pass laws like the bill that we got passed, Oregon Staffing Law, which also expanded staffing committees to others in the healthcare profession. So pros and techs like physical therapists, occupational therapists, speech-language pathologists, so that they can have some control over the staffing in their hospitals and work environments. And then even for the service staffing folks who are doing environmental services, which is critical in a hospital, sterile processing. It is all foundational to being able to provide care to our communities, and that bill was important to get that going. And it is being implemented over a phased process. And so come June, we will kind of complete most of the phases, and hospitals could start to be held accountable with financial penalties if they violate the law. I think one of the beautiful things about our law is that we have created these staffing committees, and that started in 2001. Oregon, as you've heard, is always like kind of a leader. We were a leader by creating staffing committees for nurses back in 2001, and then in 2015 we fortified that law, and then again in that 2023 session to where we have a shared governance process mandated by law that equal parts direct care nurses and equal parts management nurses come together in a committee and create staffing plans for the individual units in the hospital. And I think that's very important, because what we're trying to do is we're trying to stop the flow of nurses leaving the hospitals. The big issue for nursing in hospitals and that affect our communities is turnover. A lot of people will say there's a nursing shortage. There's not a lot of academic research to support that. There is research to say that there's a 24% turnover in a lot of departments. And so when you're replacing staff like that you're never going to grow a workforce to replace that level of turnover. And then when you break it down and you look inside the institutions, you can see nurses leaving very specific departments and going to others where they don't leave. So we know that good work environments can keep nurses. Nurses leave the emergency department and the stress there, and they go to the post-anesthesia care unit where they have a better work environment. or they go to a short stay where they have a better work environment. Nobody leaves PACU and goes back to the ED. Nobody leaves the cath lab where I work and goes back to the ICU. There's a one-directional flow, and it's working conditions and it's staffing. And that impacts, it's very expensive to replace a nurse, so that impacts where our community's health care dollars are going, and it impacts the care that you receive because of that constant churn. You cannot turn over 50% of your departments every couple years and maintain high-quality care. So that is the genesis of why we passed the law, and that we keep on fortifying the law and giving nurses a voice. We need to get nurses' voices on the boards of directors of insurance companies, on the boards of directors of hospitals. If you go and you look across the state, there's very few RNs on the boards. The only one I could find was OHSU, who was appointed by the governor. It was not because of the benevolence of the medical system. So I will save the rest for later and answering questions, but thank you all for having us here and hearing us out.
I always forget Eve is a nurse as well as a community leader and an advocate and doing a whole lot of other things. Nurse Gray, will you give my kids their vaccinations, please? Not a chance. Okay. All right. So our newly elected representative to the Oregon House of Representatives has very deep Eugene, Oregon roots. She told me today that she actually doesn't get hazed. She's a freshman congresswoman, and she does not get hazed because apparently the House doesn't do that. So, Representative Fragala, thank you for joining us today.
Thank you. So, good afternoon. My name is Lisa Fragala, and I represent House District 8 in the Oregon House of Representatives, and that's Central and South Eugene, plus part of the Crow-Applegate-Lorain Valley. I like to say my district goes from the Willamette River to Spencer Butte. So I've been asked to talk about a bill that was introduced in 2024, in the 2024 session, and that's House Bill 4130. So it's in the current 2025 session as SB 951. And it relates to the corporate practice of medicine. The intent of the bill has not changed from 2024. It's only gotten better through extensive input and community engagement. It addresses the lack of restrictions on corporate ownership that left so many people within the healthcare system desperately in need of care when we already have a shortage of primary care providers. I'm proud to be a chief co-sponsor of this bill, along with many others, and the primary carrier of the bill is House Majority Leader Ben Bowman. So like many others said already today, I also believe that health care is a basic need or necessity. I agree, it's a human right, and I'm proud that in Oregon we've acknowledged that right in our Constitution. So what we're talking about with this bill today is about addressing a growing crisis in healthcare, both in our community, and we have made great progress in Oregon when it comes to healthcare, with healthcare coverage. And 97% of Oregonians have healthcare coverage, which is a historic high. But we have significant challenges when it comes to access and affordability of healthcare. And this is in large part due to the impacts of corporate consolidation and vertical integration within the healthcare industry without the appropriate guidance or requirements of corporate ownership within the healthcare industry. And that's what we're working towards, is towards the appropriate requirements of corporations. So we're bringing this bill back this year as part of a continued effort to curb the influence of corporations in our healthcare system and reduce the threat of restricted access and the rising costs of care. SB 591 continues Oregon's tradition of local control in healthcare, with medical decisions made by licensed providers and patients. At the heart of the bill is the idea that medical care should be between a doctor and you, the patient, and that decisions that intimately affect patients should not be controlled by a corporation for profit. So I think we've all heard the stories about what happened at Oregon Medical Group when it was taken over by Optum, aka United Healthcare. Thousands of patients in the Eugene-Springfield metro area lost access to health care. And I've personally heard from hundreds of constituents about this issue. I used to have a healthcare provider at OMG as well, and I also lost that healthcare provider. I've also heard from many physicians about doctor burnout due to absurd patient quotas and the stress of being made to act in conflict with their values and their medical oath of practice. So SB 951 is about addressing what happened at Oregon Medical Group and is happening in other Oregon cities. It's about closing significant loopholes in Oregon's corporate practice of medicine law that are being exploited by multi-million-dollar corporations and private equity firms. It stops management service organizations, MSOs, like Optum, that do not do medical work from running both the MSO and the entity that does medical work, like a professional healthcare provider like Oregon Medical Group. It aims to reduce the alarming rate at which private equity is swallowing up independent clinics, impacting community care and leaving Oregonians with no options. So when we see consolidation in the market, we see three things happen, and we've all experienced this: higher prices, negative effects on the quality of care, and decreased access to care. SB 951 seeks to address this crisis of cost, access, and quality of care. It also will address the issue of non-compete agreements that resulted in so many patients not having information about where their doctor was after they left OMG. So non-compete agreements for staff doctors will be void and unenforceable. So SB 951 is currently working its way through the state legislature. It's in the Senate. It'll have a public hearing this coming week. I will be providing testimony, and I encourage you to submit testimony in support as well. I still have a little bit of time. I want to represent Nancy. I want to give a shout out to Representative Nancy Nathanson, right? As was already mentioned, has demonstrated a tremendous amount of leadership in our community during the OMG crisis and when Eugene's hospital closed. So SB 951 is a very comprehensive bill that relates to the corporate practice of medicine. But Rep. Nathanson also has two additional bills that address this issue. One also looks at non-compete agreements, but goes beyond that to also address non-disclosure, non-solicitation, and non-discouragement agreements, and it prohibits retaliation, which we have seen doctors experience. And the second seeks to clarify the physician in charge, specifically ensure that physician care groups are run by practicing physicians. I am also supporting these bills in the state legislature as well. So thank you very much for the opportunity to be here today. Maybe you should submit that question, but I will look in my file and find it.
So back when we were getting ready to come out on the stage, Senator Manning yielded part of his time to the Congresswoman from District 8. So I'm not showing favoritism by letting her have extra time. If I was showing favoritism, it would be to Senator Manning. But in addition to the panelists on the stage, in addition to Mayor Karin Knutson, we have Councilor Jennifer Yeh, City Councilor Jennifer Yeh, City Councilor Randy Grove, City Councilor Matt Keating in the room. We have members of the Eugene Budget Commission. Boy, they've got a tough job right now. Anybody want to take their job from them? Okay, well, that was, don't all volunteer at once. We have several of the police commissioners here as well. I would love to say that all these folks came because I am just that cool and they really want to be where I am. But the truth of the matter is that this is such a big deal. Everybody feels it, everybody knows this is a big deal, and everybody wants to know what's coming next. So they are here out of the goodness of their hearts, and they're spending their sunny Saturday afternoon with us as well. We're going into Q&A now, and I'm going to warn all of you, this is going to be rapid fire, so I hope all of my panelists are wearing their fast shoes. I'm going to read off 2 of those blue lottery tickets that you were given. I'm going to read off 2 of those numbers. By the way, you didn't have to write your name on them, so I don't know who you are. I will try to find the one that has my husband's handwriting and like scoot that off somewhere else. But if you have the numbers that I call out, I need you to wave at the friendly folks in those neon yellow vests, and they're going to bring the microphones to you. While they are doing that, I'm going to read one of the written questions that has been submitted, and the panelists addressed will have 1 to 2 minutes to respond, and then it's your turn. You will have 60 seconds to ask your question, and I believe there will be a countdown timer on the screen. I can't come to you and take the mic away, but the ushers might. So, after the 2 audience live questions are addressed, I'll call 2 more lottery ticket numbers and we'll go through the process again. The first question we're going to start with that was submitted by Eugene Healthcare Coalition, I'm actually going to direct at Senator Manning. Senator Manning, will the Universal Health Plan Governance Board receive enough funding to complete their work?
Great question. First, I'd like to defer the actual answer to that over to Amy, who is on the governance board, Universal Healthcare Governance Board. I intend, as I mentioned earlier, full funding of the governance board because this is critically important to me. It was mentioned previously about the actuary that did some work from the task force. They came up saying that Oregon is losing currently about $1 billion a year in healthcare related costs and expenses. Under the Universal Healthcare Plan, and not everybody is covered. Under the Universal Healthcare Plan, everybody will be covered, and Oregon will be saving just shy of $1 billion a year to put back in there. No out-of-pockets, no co-pays, all those good things. So I will be fighting for every dime that the governance board is reaching for. I want to allow them to do their work because I didn't want to come in with a proposal that would be less than what they actually need. I need to hear from them. So I defer that. Those numbers that they bring to me, those are the numbers that I will fight for. Thank you.
And I would say that I think we're going to need more money. And we started a budget conversation at our February meeting, and I think we're going to be going deeper at our March meeting. So I don't have specifics, but.
And again, I didn't want to shoot too low because if I did that, then I would be undercutting the board. But I'm looking forward, and I hope that the board will reach out to me and say, okay, here are the numbers that we come up with now. These are the numbers that are critical. These are the numbers that we can't do with, but we need more on this end. And I'll fight for every dime that you need.
Thank you, Senator. I do want to encourage people, while I'm thinking about it, since I mentioned the meetings, that all of our meetings are, there's opportunities to give public testimony. You can give written or oral, and that includes the committee meetings. And if you go to, if you Google or use whatever internet browser and put in Universal Health Plan Governance Board Oregon, you'll find our website. And you can see under meetings how you can join the meetings over Zoom, or you can come to our meetings in Salem. We are going to, in June, we're hoping to have somewhat of a draft plan that will start engaging the groups that we are legislatively required to engage with, as well as the public. And we are talking about doing alternate meetings around the state so that we can do more public engagement that way as well.
So clearly, I already forgot what I had said I was going to do. So now I will read some blue lottery ticket numbers. Do they all start with the 28278? Do I need to read the whole thing? Okay, let's go with 28278. 115, if you have 115, please throw your hand up in the air. And 087, and our volunteers will come find you, and I'll go to another written question. So those numbers were 115 and 087. So the next question I'm going to direct to Eve Gray, who is a nurse and apparently not going to give my kids their vaccinations. What is Oregon State and Lane County Health and Human Services, what are they doing to prepare for cuts to Medicaid and Medicare?
Thank you for the question. Let me be clear, I would be happy to give vaccinations if someone like Matt reorients me. I have not been a clinical nurse in about a decade. What are we doing? Right now, it is watchful waiting. The best intelligence on Medicare right now, and as a reminder, Medicare is for those who are age 65 or older or have some specific other qualifying factors, for example, dialysis. Medicaid is the income or means-based health insurance for people who do not have other access to health care and cannot afford it. Medicare appears to be not on the table for discussion right this second. Anything can change, but right now the word is that Medicare is not where funding cuts will come from. Medicaid, there are a number of proposals on the table, some of which are included in the budget package that the House put together, though the Senate has a very, very different budget package, and they have to come to agreement in order to get something to the president's desk. So once any changes are made at a federal level, Medicaid is a program that's shared between the federal government and state governments. So the federal government pays a certain percentage of the Medicaid program, and then states pick up the other part. Any cuts that were to occur to the Medicaid program would go to our senator and our representative for discussion and identify how will Oregon respond? Does Oregon have resources to fill in some or all of those gaps? Or do we need to look at reductions in one place or another? From there, the state will have to decide, what does that mean? Does that mean, if there are reductions, does that mean fewer people are covered? Does it mean fewer things are covered? Does it mean providers are reimbursed at lower rates? There are multiple ways that you can close that budget equation that have different effects on the community. And from there, I will be able to respond to your question. But that's what we know right now.
Yes, go ahead, Amy.
I just wanna
Senator
add-
Manning, hold on just a moment. Senator Manning, I believe your staffer would like you to accompany him away now.
Thank you, Senator.
Thank you very much, Senator Manning. Amy, go ahead.
I don't have any details, but I want to. Thank you, Senator. I just want to direct.
You know what? That's where we elected him to be.
Yep. I just want to direct people to watch the state's response to all of the executive orders, at least in terms of health-related things. The Oregon Health Authority has put a public-facing website together. So if you go to the Oregon Health Authority and I think if you put in federal or maybe executive orders and Oregon Health Authority, you'll find the page, and they kind of have it split down into different categories and what they're watching: Medicaid, gender-affirming care, reproductive health, like into different categories, and how they're watching that. So I think that's where we'll see, as the general public anyway, how Oregon will respond.
Thank you.
Cena, I'll be quick.
Yes.
So I wanted to mention that while at the federal level there are discussions about cutting Medicaid, just this last week in the Oregon House, we passed House Bill 2010, which is going to address healthcare issues for Oregonians. It's a critical measure that ensures ongoing funding for the Oregon Health Plan, which covers 1/3 of Oregonians relying on OHP. That's 1.4 million people, including over half of Oregon's children. So I want you to know that we are deeply committed to making sure that Oregonians have the funding for this program to continue, and that is one of our top priorities in this legislative session.
Thank you, Representative. I will call two more blue ticket numbers, 155 and 127. If you have either of those, let the folks in the yellow vest know that you would like the microphone brought to you. I have another written question that I'll direct to. You want to keep reading numbers till we get somebody? All right, we can do that. All right. 122. Anyone? Okay. All right. And is there a 122? Over there. Okay. All right. So they will bring the mics to you, and we'll go to the next written question, which comes from my friend and primary care provider, Dr. Nicholas Jones with Clear Health DPC. His question, Dr. Jones, which panelist do you want to answer that? Okay, Representative Fragala, you're on the spot. With federal support for Medicaid under threat, what can Oregon do to protect our vulnerable populations and prepare for an increase in uninsured patients?
Great question. Thank you for that. Well, we're already working on ensuring that we have the structures in place for adequate funding in the state, and that's why I just mentioned House Bill 2010, right? That's the provider assessment, which taxes hospitals and other large providers in the state, and it puts more dollars into our healthcare industry. In addition to that, there is a task force or working group that is convened by the governor. It includes members from each agency, and it also includes some of the statewide elected leaders like the Attorney General. And we're basically in emergency planning, right? So we're looking at every agency, unfortunately, and trying to decide where we can make cuts in preparation for what could potentially happen. That being said, even though we're emergency planning, we can only respond to what actually happens. And so I think it's really important to remember that the current administration is doing something called flooding the zone. They are spreading chaos, they are spreading fear, they're doing it a lot, and they change constantly. And that is to create chaos in our own state governments. So we need to also be patient and wait to see what happens. Our Attorney General has been involved in filing multiple cases, as well as some of you may have heard, and it's not related to healthcare, but the Eugene 4J School Board recently joined a case. So we are pushing back legally. We are preparing. And when something happens, we'll be ready to respond. That being said, the thing that we need to do now is to apply pressure to our congressional leaders. I am not a member of Congress. I'm a member of the Oregon House of Representatives. And we are very fortunate to have exceptional leadership in the Oregon State in the U.S. House of Congress. We have two fantastic senators, Merkley and Wyden, and we have other incredible congresswomen, and then we have one congressman, Cliff Bentz, who is part of the Republican Party, who needs to hear from you, even if you're not in his district. And if you have friends in Eastern Oregon, you should encourage them to contact him. And if you have family and friends in states that have congressional leadership that are Republicans, they need to hear from us. This is about applying pressure. Nothing will change until, as Eve said, Congress comes to a definitive conclusion. And so we need to apply pressure at that level. People in their states are already starting to push back, right? This will have an even more significant impact in quote-unquote red states. they actually receive more funding than many of the blue states. And so that, I think, is where the pressure point should be.
All right, we'll go to the audience. So let us know which panelist you're addressing your question to, please.
Direct it. It may be a no-brainer, but I would like to know, as a simple member of this society, why does Peace Health Riverbend Sacred Heart Medical Center keep cutting programs, staff, buildings, possibilities for many of us in town?
Who wants to step into that? All right, Valdez. They're working on it.
So I'm not going to presume to speak for that organization. I will say, and this kind of motivates the whole need for systemic statewide transformation in this area, is that I remember I attended it was like a Chamber of Commerce Leadership Development breakfast thing I was asked to speak at a couple years ago. This was December 22. And the gentleman from the Oregon Hospital Association, kind of lobbying group for the hospitals, showed up to kind of give an update on hospital care. I was there to talk about public health. And it was interesting because back in the day, he said, they kind of defined success in their strategic plan for if you're a healthcare hospital system as a market share, as growth, as hiring the best surgeon in town, and hiring surgical robots, and having the kind of technology they could put on a billboard that would attract you to come to their place instead of the other place. And that, he said, but this is in December 2022, he said, success in 2023 at that time looked like not losing a hospital in Oregon. And then what happened in 2023? The Baker City Birthing Center, Legacy Emmanuel's Birthing Center up in Portland almost went under, or almost closed down. They ended up being kind of like denied that by the state. All these organizations, the consolidations right here that we're talking about with OMG and up in the Corvallis Clinic, and the consolidation. And so what keeps happening is, the dollars are going to the wrong places. I really don't believe that, the hospitals themselves are these greedy entities that are racking up all kinds of money. I think that the insurance company is shortchanging them, honestly, and it's getting the care is not going between the patient and the provider at the hospital. It's going to these other places. One of the reasons that the hospitals do try to consolidate is because the bigger you are, the more market share you have to negotiate your payer rates. So the bigger you are, the more you can, kind of arm wrestle with, the Blue Cross, Blue Shield, United Health, or whoever the kind of insurance plan is. And so there's this perverse incentive for them to grow and grow and grow. And then also when the Medicaid rates and the Medicare rates are a bit below the commercial rates, depending on 1 in 3 Oregonians is covered by OHP, especially if you're in a rural area, a critical access hospital, the funds aren't there, and so you're kind of reliant on trying to figure out these different ways to get more and more infusions of cash from MSOs, from outsiders who kind of see Oregon as this blue market, territory where they can kind of come in, and they've kind of dominated the East Coast, and now they've been creeping into the West Coast, which is part of the reason that we're here today is because of this happened. So I'm not going to presume to speak for why the closures are happening, but I can say they are, I think, motivated by a collective system of the insurance mechanism, the finance payer mechanism, the role of insurance, obviously workforce challenges post-COVID, but more, it's just another symptom of our broken healthcare system, which is highly fragmented, insurance-based, and underfunded.
Okay, we have another live audience question.
In the first forum that we had back in September, the CEO of McKinsey Willamette was here. He stood up and mentioned that they're hoping to open an emergency room on the west side. Jensina, you read a statement in the beginning, but we don't see them here, and I'm wondering if anybody has any updates or any other information. I hope this thing is going to be real. We had an opening, not a closing, and that this idea doesn't fade away.
Yes, they're envisioning. There was a part of that statement that was made that seemed to be premature to be made publicly, and so the information that we have now is the latest. I was just double checking with some of the city leaders here, and it does not look like we have an update more than that. So that's a really wonderful question. I think we all want to know, when do we get an emergency room? Where is it going? What can they treat? What do we do? What can we do to not have to go to Springfield for everything? Thank you for that question. I've got another question for Battalion Chief Kamppi. Does Eugene Springfield Fire have the funds and the personnel to be able to serve our community?
Thank you for that very loaded question. I think it is very important to think about how ambulances are funded versus how fire engines are funded. Ambulances are funded by fee-for-service. We are very dependent on our payer mix. Right now, we see about 70% of our population is either Medicare or Medicaid that we serve on our ambulance service. It makes it incredibly difficult to close the gap of what it actually costs to run an ambulance service and to cover with fee-for-service. We are always looking for new people to come to work at Eugene Springfield Fire. We have seen an exodus of people who are retiring. They have met the age where they are eligible to retire and have left the field. We are also seeing a transition of where we have migration of employees who want to go to areas where they may not be as busy in their day of shift, and they are seeking places where there is not ambulance transport and there is not as many calls for medical service in those communities, the Portland area. They also pay more. And so we do see an exodus of people from our organization to places where they are paying more, where they are working less. It is difficult. There are not as many people who are entering into the medical field. It is hard to find people who have a servant's heart, who may need the opportunity to test it out. In Eugene Springfield, we're very fortunate. We have built a basic life support system here of where people can take a term of college and come to work on a basic life support ambulance. When they do that, it is an opportunity for them to decide if this is something that they want to pursue. As I told my children, it's an opportunity to taste the soup. You can taste it, and if you decide you like it, then you can commit to further education. And in our state, an associate's degree is required to become a paramedic. Oregon, over the last year, has relaxed that to where if somebody wants to become a paramedic in this state, they have 5 years to do that associate's degree, which would normally take 2 years. There are definite workforce challenges as we move forward. Do we have enough funding? I'm not sure we'll ever have enough funding. But what I do know is that we have a lot of competing interests, and we have a lot of really great people who are working at Eugene Springfield Fire who are doing their best to serve this community at the very highest level.
Thank you, EMS. I have 2 more ticket numbers to read, 097 and 133. If you have 097 or 133, wave your hands, and we've got one down here. Do we have 133? If we don't have 133, then we will move on to 104. We do have, okay. All right, so we'll bring the mics to you, and while they are doing that, I'm going to come down here to our mayor, who actually has an addition to that last loaded question.
Well, and maybe the question before, I did also have the really wonderful good fortune to be with the battalion chief yesterday as we welcomed new graduates into, through the EMT and into Eugene Springfield Fire, people who have stepped forward and decided that they tasted the soup, they have that servant heart, and they are now working for our community. What I mentioned to Jacina that I just want to offer a few more thoughts about is the gentleman's question in the back about returning emergency room service in our community. And it is true that it's not the appropriate time for a public announcement or for sharing more information about that decision. But this is a perfect example of what I alluded to in our introduction about the active muscle of being hopeful. And that when hearing that there's not yet an announcement and not yet news that is perfectly reassuring, to not immediately presume that that means that the news coming is bad. So hang on, sit tight for a second. There's more work to be done. That's not the only work happening in our community as well related to expanding healthcare access. But I just wanted to say that because this is important for us as we think about how it is that we meet these current challenges and not miss the opportunity to stay engaged and learn about something that's coming that helps us.
Okay, audience questions. Let's start with this lady here in the front.
Well, my question is for the nurse, because I'm a nurse. I'm a nurse educator. My question is for the nurse. I'm a nurse educator, and many of my CNAs, nursing assistants, are wondering how ratios with nurses are going to be affecting them. Do you have any insight into that?
Yeah. So when we passed that legislation in 2023, it is the first to provide ratios for CNAs in hospitals as well. And I think what has been happening across the state is there's a lot of challenges around that. So to be reimbursed by Medicare, you have to have an assessment done by a registered nurse and a care plan. And so hospitals then have to have registered nurses. So right, they can't say, well, we're just going to get registered nurses because we don't like a law. They can't get reimbursed by CMS if they don't have them. Not so for CNAs. So we've seen healthcare institutions do a lot of, reinterpreting of the definition of assign and delegate, which are actually those definitions are in Oregon's Nurse Practice Act. So we've seen attempts to kind of creatively interpret those and to try to avoid the ratios. I think there has been at least one hospital up in Portland that did reduce their CNA workforce. That's a big problem, right? This is, again, I think when we're getting together as a community, these are the things we need to talk about. Our healthcare dollars are for care. They're not for CEOs to make $10 million over 2 years. And when you look at the CNAs, they have some of the highest rates of back injuries in all industries, more than people working in the timber industry, more than people on the fishing boats. CNAs and nurses have, and CNAs in particular, have really high rates of back injuries. They're not appreciated in a lot of the healthcare system. And so we have worked to legislate with that law ratios so they at least can work towards better working conditions. They have a voice on their staffing committee, which is a service staffing committee. I know at my hospital, I'm the co-chair of our staffing committee, and we've tried to work really hard to make sure that CNAs have a voice within our staffing, the nurse staffing plans. But it is a challenge, and I think that so long as we maintain a system in which our healthcare dollars, whether you own a business and you insure people or you are a worker and you get insurance at work, all of that is our money, and it is leaving our communities and going to a very small group of people. And that is going to be the fundamental change that needs to happen so that we can get CNAs providing care in healthy work environments so that they stay in the profession and maybe they grow to LPN, to RN, and we create pathways to create an economy that's around caring for each other versus the economy that we're seeing on a national level that's happening right now. And with the boomer generation retiring, we need an economy that's going to care for each other.
Hi, my name is Corinne Gilbert, and I am the Director of Development at Bushnell University and have been working to raise the funds to grow our nursing program. And my question is really for you, Senator, or Representative Fragala, is we talk about needing workforce growth in all sorts of areas, behavioral health, with Lane County Health and Human Services, with nursing, with other levels. We know we need PAs, we need nurse practitioners, family practice docs, you name it, OTs, PTs. We are desperate, and we're relying on outside expertise. So what are we doing at the state level to actually grow our own? Because we know that this 6-county region is a health professions shortage area for both behavioral health and primary care. So we can't, educators, we can't do this without external funds because these programs do not bring in enough money to sustain themselves. So how do we grow our own if we're not thinking long-term and we're just trying to fill the gap by hiring traveling nurses, by bringing in people from out of state, especially when we know our reimbursement levels are so low compared to other states, we don't have a way to incentivize people. So how are we responding at that?
Thank you for that question, and that's something I'm actually very passionate about. I served on the Lane Community College Board of Education and really got very passionate about workforce development. And I'm very fortunate in the Oregon House to serve on 2 committees that are an intersection of workforce development. I serve on the Higher Education and Workforce Development Committee, and I also serve on the Labor and Workplace Standards Committee, which is the committee that looks at apprenticeship models in the state. Additionally, after teaching elementary education for nearly 25 years, I moved to working in higher education at Pacific University in the College of Education, which has a local satellite campus here, and worked on grow your own programs for teachers, as well as working on developing a teacher apprenticeship model. So I know a few things about this, and there is a lot of interest in building apprenticeship models or pathways that support people to earn as they learn. It doesn't necessarily have to be an apprenticeship model in lots of other professions as well. For example, there's an apprenticeship program for firefighters, which LCC also collaborates on. We don't actually have students here in Lane County, but we collaborate on a program that's housed, I think, more in Douglas County, right? So anyway, some of the things we're looking at are, like I said, developing apprenticeship models where people can earn as they learn. And also we have several bills that are in the House at this time. One is specifically to invest in higher education for mental health and behavioral health workforce development. I very much think that mental health care is a very important component of our healthcare system. This bill would invest significant dollars in universities and community colleges to help boost the number of people that are participating in programs for behavioral and mental health, in addition to also allowing these programs to expand by hiring more faculty. There are also other bills that are looking at doing things to help expand consortiums around how we do workforce development. So a couple of years ago, I think it was the last long session, there was a bill that passed to allow community colleges to have a baccalaureate in nursing. And what this allows us to do is to have community colleges training nurses so that we can do it all over the state. Because what we know is that healthcare providers often, after they finish a program, they stay in the communities where they're trained, right? And that we have these programs too concentrated in certain higher education institutions. I really believe in decentralizing how we train healthcare professionals. And so what has happened with the nursing baccalaureate is that there is a consortium of community colleges that are working together to utilize the staffing, the faculty that they have
so regional clinical training, and then remote or classes like in something like Zoom, remote instruction that utilizes all of the community colleges in the consortium, right? So that expands the number of students that can be learning in Eastern Oregon and Southern Oregon, where we have significant decreases. So we are looking at ways that we can expand those pathways. One other thing that I would also mention is that in this session, there are 2 bills around workforce standards boards. And I am currently sitting in a work group on a workforce standards board for farm workers, but there is also another workforce standards board that is for long-term care providers, and I believe that does touch on some CNAs. And what these workforce standards boards are doing is they will look at working conditions. If they're passed and they're established, they will look at working conditions, they will look at wage and benefits. And so I am supportive of this idea, because I really think we need to make sure that people are earning a strong living wage and that they can be paid and compensated for the hard work that they do, and in addition to having good benefits. And I think this is one way to get at that.
Thank you, Rep. Fragala. I have ticket numbers 123 and 104. 123 and 104. It's kind of interesting that this topic came up. Most of you may be aware of the nurse and provider strike that happened at Providence. I have a cousin who is out of state who was offered $100 an hour to come be a strike breaker at the Providence strike. Thankfully, our parents raised us right and we ain't no scabs. But do you see anything wrong with that? They are willing to pay someone to come from out of state $100 an hour, but gosh knows they don't apparently have the money to keep the nurses that they actually have on their team who are local and living in their community. I'm going to give the next question to Eve Gray. By the way, did we find our ticket numbers, our last 2 ticket numbers by any chance? Okay, I'm going to grab a couple more, and then I'm going to give the next question to Eve Gray. So we're going to go with 067 and 129. I wonder if people took these tickets because they thought they were going to be in a drawing for a door prize. 067 129. Oh, no, not you. Okay, let's go with 139. Okay, that works. If you want to ask a question on the microphone, raise your hand. The ushers will bring you a microphone. Eve Gray. So I'm going to direct this question to Eve because Eve is kind of the Swiss Army knife of healthcare forums. She can answer any question. So when I get a question and I don't know who to give it to, I look at Eve. Director Gray, is it possible to create a U of O and or OHSU research or teaching medical facility in Eugene or in Lane County?
Anything is possible with the right budget. I think if we're talking about medical school here, which I think we probably are, medical schools, the pathway to be able to create those from the ground up, that's a pretty tough road to hoe, and is also not really well aligned, I think, with the University of Oregon with their direction. Certainly Oregon Health Sciences University, it is well aligned. Our closest medical school, some of you may not know, is in Lebanon. It is run by Comp Health. It's called Western University, and they train doctors of osteopathy, or DOs, who can go into residency programs. What we find in medical schools is that whereas it is absolutely true that most of the time, where you graduate is where you stay. For doctors, they have to go to a residency program, and that residency program is often not in the same community where they studied. So they head to their residency. From there, they graduate, and they tend to stay. So our priority right now is much more heavily on the development of a residency program within Lane County than it is on a medical school within Lane County, because that's what will bring folks here who are doctors, who are setting roots within the community, and when they complete their residency, all of us will be happy to offer them jobs and have them stay. So right now, Peace Health is a great leader in this community on visioning what a residency program might look like. There are a number of us from healthcare organizations who are being invited into conversations about what that might look like. And you're required, when you're starting a residency program, you're required to start with primary care and or psychiatry, and then you can add specialties from there over time. So these are discussions that are underway. Lane County actually provided some initial seed funding to Peace Health to begin their residency program study, and that work is continuing, and we're hoping that there will at some point be a residency program in this community. It's very long overdue. We are way too large a community to not have one.
And that's why I ask Eve Gray. Tom, by chance, are you standing with Mrs. Pendleton? You lucky fellow. Folks, this is the mother of the previous president of the NAACP, and she is a delightful lady. Francois, the mic is yours.
Okay. Yeah, now you can? Okay. My name is Francoise. Over the last 3 or 4 weeks, we've heard about substantial, significant cuts to NIH, which is the National Institute of Health funding for research grants. Clinical trials have been suspended. Universities are not being funded to conduct research. I have a spouse who has a terminal heart condition, who is very much reliant on research and drug clinical trials. And I'm curious, and I guess for you, Representative Fragala, perhaps you could help me understand what can be done legislatively, both at the federal and at the state level, to ensure that those funds make their way into the universities, make their way into the research labs, so that drug trials, advanced disease treatment can continue to have the research, the necessary research conducted.
Thanks for the question, Francois. So the only thing that we can do at the state legislature at this time is to plan, like I told you, for some of the most devastating impacts from actions from the current federal government. Our budget process happens in the long session in odd years, and that's why we are currently looking at the emergency planning for what we should do based on some of the devastating impacts of the executive orders at the federal level. We won't know what that looks like until we get later in the session, and unfortunately, we may not know until after the session is over at the end of June. Fortunately, we come back for a short session early in January, and that isn't that significant of amount of time. It's not like when we have the gap of time between the short session and the long session, but we have had conversations about having a special session if we need to, like the current special session that paid for wildfire damage and fighting in last summer. What I will say about the NIH grants is that there are multiple lawsuits that have been filed by attorney generals across the United States, and our attorney general is very engaged in that process, very engaged in pushing back on the executive orders. And at this point, the most damaging 6 out of 5 of those executive orders, the lawsuits are holding and are successful. The question is whether or not the current federal administration is going to acknowledge the rule of law in the courts. But what we've seen so far is that they're looking, in my opinion, to test the boundary of the balance of government within our country, and they have taken a step back and shifted direction when the courts have held them accountable. And so for the time being, it's, I think, working. We will continue to plan, and our Attorney General, Dan Rayfield, will continue to collaborate with other Attorney Generals, and we'll probably file many more cases. And then we need to keep our sights on, as I mentioned earlier, pressuring Republicans in Congress. And we also need to be looking towards the midterms. It's not that far away. So I encourage you to support our current congressional delegation. The path to strong representation in the federal government goes through Oregon in the House. We will have some vulnerable congressional representatives here in Oregon, and I encourage you to get involved there. And I also encourage you to take the time to think about how you can engage locally in ways that help in of so many ways, right? There are lots of nonprofit organizations that need our support. There are systems that we have, from food banks to community-supported shelters to a great variety of services that are done by our own community members. We all know somebody, and so we all can get involved in some way. This is going to take us coming together as a community to weather the storm, but I believe that we can weather the storm, and that when we come through it, we will hopefully come through it stronger.
Thank you, Representative. We have time for one more live audience question.
Test, 1, 2. Hi, my name is Jeff Baldwin. I wasn't born in Eugene, but I moved my family here from Portland when I was 5, so I've been here a while. Valdez, you may be the best person to respond to this. Adam Smith wrote that the natural result of markets is monopolies, and they must be regulated. We're not regulating our insurance companies very well at all. Is it possible for Oregon to begin its own nonprofit insurance company?
Well, and I'm gonna ask Amy to jump in here just to kind of validate what I'm saying here, since she's the expert on the board. But essentially, that's kind of what the Universal Health Plan Governance Board is. It's a way of, instead of directing our money to insurance companies and other third-party outfits that have that profit motive, and then pretty pleased with sugar on top, will you pay for my care? It's really just taking them out and creating almost the Universal Health Plan would almost act like a statewide, for us, by us, Oregonian insurance plan, right? With its own governance board, with transparency rules, and that the legislature and the Oregon voters would make real. And so I'll ask Amy to talk about that. Let me take one moment to say how we're going to get there to do this, so it'll save me my minute for something else later. But basically, what Healthcare for All Oregon is doing, we have one of our board members has just been recently appointed to this Universal Health Plan Governance Board that is currently being built right now. It's kind of like a working model, right? We always hear, how are you going to pay for it? They are building the plan and the prototype. So what we tell them is, you're building the house. We're all going to live in this house one day, but you all are building the house right now. And then what we're going to do at Healthcare for All Oregon is make sure that everyone across Oregon knows about this house. We'll be the real estate agent to sell the house. And so we're going to make sure that once we have that plan, we will work with our friends in the legislature and advocates to make sure that, likely wouldn't be a legislative referral where they would just make it so. But they can refer it to the ballot for us, so we don't have to do all that work of going around and collecting how many signatures that would be. But then once we get that to put it to Oregonians, we're going to need Oregonians in Lane County, in Multnomah County, Jackson County, Grant County, Malheur County, all across the 36 counties to vote to adopt the plan. And if they do, depending on how the implementation and design phase is mapped out, it will go into progress, and that might be a phased approach, or we're not sure what that looks like. That's what they're talking about. That's why it's so important to dial into the meetings that Amy's talking about, to go to the website, Google Universal Health Plan Governance Board, tune into the committee that strikes your fancy. You might be into operations. I'm an operations guy, but you might be into implementation and design or community engagement. But we're going to need Oregonians to do that. So the work that Healthcare for All Oregon is doing between now and then, and this isn't like a 10-year plan. We're talking like several years into the future here. What we're trying to do is make sure that people, especially there's a lot of righteous outrage all across America, post this United Healthcare CEO slaying and Luigi Mangione and all these kind of things. People are testifying on social media and in their own ways to letters to the editor and everything. Oh, I thought that was just me. I thought my family was the only one. I thought I was the only one that lost a child due to denials of care and fights. Oh, I thought I was the only one that lost a family member to a screening that was missed because it wasn't paid for. All these kind of things, there's this outcry all across the nation where people are realizing and almost having a self-awakening of like, wait a sec. It's like in the Matrix. Everyone's taking the red pill and they're like, what are we doing here? What are we going to do about it? And so we're making sure that they know about these issues here in Oregon. The Healthcare for All Oregon has a plan, how to get involved, and then once the good folks at the Universal Health Plan Governance Board tee it up, they'll be that much more informed and farther down the road to be able to vote on and make it happen. But did you want to touch on the aspect of this almost acting like a de facto public insurance plan?
Yeah, hi. Now I get to use the parts that I had to cut out when I only had 5 minutes. First I want to kind of tell you, and I'm trying to recall from memory, I should have jotted this down, who the Universal Health Plan Governance Board members are besides myself. So our chair is Helen Belanca. She's a physician. I think she currently works for Kaiser Permanente, but she has a background in being at a nonprofit organization in Portland whose name I'm blanking, but that was focused, I think NARAL? She was focused on reproductive health, so that's she has that background and is a primary care provider. The vice chair is Judy, whose last name I'm blanking on, but thank you, Judy Richardson. She works for OHSU at one of the federally qualified health centers, so she sees uninsured and Medicaid-based patients. Bruce Goldberg, who was the former medical director for Oregon Health Authority, and so he very much understands the workings and what will need to, be reshuffled for this to happen. And he was, when I first met him over 25 years ago, the medical director for Care Oregon, which was kind of the first managed Medicaid organization in Oregon before the CCO model. Deborah Diaz, who is a physician's assistant. I think she may also work for the OHSU FQHC. She just changed jobs, so I don't remember exactly. Dr. Chinwei Chi, who was my professor at Oregon State when I did a healthcare administration undergrad degree back in 92 to 96. And he also has helped with Taiwanese, right?
Yeah, their national plan.
The Taiwanese, yeah. So he helped write the national plan for the Taiwanese government.
He's there right now celebrating their 30-year anniversary.
Oh, that's right. So somebody who has actually created a universal health plan. Cheryl Ramirez, who represents mental and behavioral health, who works for an organization that kind of supports mental and behavioral health organizations, and I'm blanking on the long name of her organization. And then Michelle Glass, who's my co-chair on the Community Engagement and Communications organization. She is a long-term community organizer, and she works for the So Healthy, it's the Southern Oregon Regional Health Equity Coalition. And our newest board member is Mary Lou Henrich, and she has been very active since retirement in Healthcare for All Oregon, and she was the founding CEO of Care Oregon. So I actually worked with her and Bruce many years ago. Did I miss someone?
And she was former deputy director at the Multnomah County.
That's right. So she had, so Valdez's job she formerly was in. She's a retired public health nurse. So anyway, I just wanted to give you guys an idea kind of who the makeup of the people in the health plan are, just so you have an understanding of the backgrounds. And then in terms of the preliminary structure that...
Hey, Amy, can we put that in your 1-minute closing statement?
Oh, yeah, sure.
Okay, thank you. On their way out, Senator Manning and Councilor Matt Keating texted me a list of the bills that Senator Manning is co-sponsoring. House Bill 3902, directing the Oregon State Board of Nursing to establish an advisory committee to study the nursing educator shortage. House Bill 3773, requiring the Oregon Health Authority to adopt criteria for veteran-specific personal health navigators as an additional category of traditional health workers. Senate Bill 734 prohibits the use of certain mechanical restraints on youth, adjudicated youth, or young persons in medical or detention facilities. House Bill 3650, creating a Latino health system task force. House Bill 2133, establishing a program to assess, monitor, and track the language developmental milestones of children who are deaf or hard of hearing. Senate Bill 1168, prohibiting per-visit compensation for home health care and home hospice care staff. Senate Bill 957, which voids non-compete agreements between a licensed health care provider and another person. Senate Bill 702, banning flavored inhalant products or flavored tobacco. Senate Bill 605, prohibits medical service providers from reporting the amount or existence of medical debt to a consumer reporting agency. Okay, we're going to get into closing statements. I've asked the panelists to keep their closing statements to 1 minute each. I know it's a challenge. While you guys are thinking how you're going to condense it all down into that 60 seconds, I'm going to invite Councilor Randy Groves to come up. Some of you may remember that the first healthcare forum was the brainchild of Councilor Groves, and he just kind of said, what would happen if you did a forum, and this is what happens. So I'm having Randy Groves provide us a super brief update of some of the stuff that happened from that forum and for the folks of you that attended that. Councilor.
Thank you. Thank you to all of you for being here today. I think forums like this are incredibly important to our community, where we can really kind of do a deep dive into some of our challenges. And thank you very much for all the panelists for being up here and committing your time. As you've been hearing, there's a lot of doom and gloom on the horizon in healthcare for our country, and for our state, for our community. But there's a lot of work being done as well. I wanted to share just a bright spot that popped out of the first forum. Well, we're sitting there listening to an incredibly talented panel from last time, like this one, sharing the problems and the challenges. It became really apparent that there were a number of issues out there, and there were some intersections between some of these issues. So we convened a small group afterwards, in the weeks afterwards, that included the Peace Health. It included Volunteers in Medicine with Lisa Mission-Tubby, and we started talking about what could we do to declutter our emergency departments, to treat people where they are who don't have access to health care, and take away some of the call load that our ambulance system is experiencing, especially with the wall time, which wall time is when patients are on the stretcher, the crew is tied up, leaning against a wall, waiting for a bed in the emergency department so they can get back in service to serve the rest of us. All these issues were having problems, plus the cost of an emergency department visit has grown exponentially over the years. And so we decided, what would it look like if we took a pilot program into Everyone Village, which is one of our safe sleep sites for the unhoused, and happens to be in my ward, our council Ward 8. And so why don't we try to set up clinic hours there? Because right now, when people in our safe sleep sites have problems, they generally end up in an emergency department. And sometimes it's warranted because a small issue becomes a large issue by the time they get treatment. And kind of along the lines of providing basic primary health care to all, Peace Health and Volunteers in Medicine, along with Bushnell University with their nursing program and their mental health program, and some others that are involved in this, are going to start operating clinic hours at Everyone Village and try to start chipping away at this larger issue. And our hope is, if it's successful there, which we believe it will be, that can be expanded out to some of our other safe sleep sites.
and even eventually try to get that out into some of our larger congregate low-income communities, which are having some of the same challenges with healthcare. And the goal being to have a healthier environment for our community, saving some money, and addressing the capacity issues of not only our ambulance system, but the hospital. For those of you who don't know who I am, my background, I was the former fire chief here in Eugene, Springfield, and worked 37 years in the fire service with over 36 of them right here. And so I've seen this kind of from the ground up. I've seen it progress. And I want to take just an extra 30 to 60 seconds. I want to compliment Chief Kamppi on responding to the question about can we handle all this in an ambulance system. I thought she did an exceptional job in her response, and she walked that tightrope that I know very well from being a staff person myself. I'm a counselor now, so I can say wherever the heck I want. I just want to share some statistics with you because I still stay very close to our fire department. I take great pride in this organization. We have exceptional people working in it. We're well equipped, they are well equipped, and they do an incredible job out there. But the staffing levels. I started being a firefighter in 1979. It's about a year and a half out of high school. I was hired on Eugene, less than 3 years of being out of high school, and worked my whole adult life, I feel like, in the service. Today's staffing level, today's minimum staffing level on the line, there's one more person on the street each day than there was in 1981. So, at the same time, our population in Eugene's increased by 75,000. Our call volumes increased by almost 1,200%. So, yes, they do an incredible job with what they have. They've been very innovative. You know, there's a joke in the fire service, 200 years of history unimpeded by progress. That is not true in Eugene Springfield Fire, and we have exceptional leadership. We've got a great staff, good firefighters, excellent paramedics, and firefighter and paramedic are synonymous now. I mean, they're paramedics to be a firefighter. So anyway, I just wanted to share that little bit of extra detail. JoAnna can't talk about it. I can.
When I became a police commissioner, one of the first meetings I requested was with Counselor Groves, and he told me the difference between police and fire is that when they see our flashing lights coming, they wave at us with all 5 fingers. All right, closing statements, and then I will wrap it up. Eve Gray, take us away.
Thank you. I just want to appreciate each and every one of you for coming out here today, and anyone who's watching or now or in the future, because it is involvement in this type of thing and at this level of community that is going to help us weather the coming storm. And I say that not to be political, just to be real, that as my department, more than 50% of my funds are federal. And the services that we provide that people rely on for basic needs and for health care rely heavily on federal dollars. And yet we as a community can come together as we are facing the challenges ahead to figure out how we plug the gaps, how we organize in a way to make sure that each and every individual in our community, regardless of documentation status, regardless of gender identity or sexual orientation or any other factor, has access to the health care that they need. And it's going to take all of us. Government's not going to be able to do it alone. I just want to be really open and honest about that. But we as a community can take care of each other. So really appreciate all of you. Thank you so much. And feel free to reach out anytime. My email's on the website. So would look forward to continued conversation.
I agree with that, Eve. It's going to take community helping community. It's going to take innovation. I feel very fortunate to have received the funding from House Bill 4136 to start the process of looking at doing things differently. We've received a $1.2 million grant from the state also to start a response program to senior care facilities, licensed care facilities, to run an alternative response program there as well that will run for a 2-year time period. These pilot studies are really important because EMS doesn't have a lot of funds to be innovative if the funding doesn't come from somewhere else. We run just enough to keep the wheels on the road of the ambulances that are responding in our community. Those innovative grants from the state and from the legislature are what will make the difference in being able to set a course for the future in what might be a program that can be modeled throughout the state in regard to alternative response for at a lesser cost in other communities. So I'm very grateful for that, and will continue to look for opportunities for Eugene Springfield Fire to be innovative and to change and to set a course of direction for the future.
I would just say, in closing comments, please check out the Universal Health Plan Governance Board website. Get engaged, give public comment, come to our meetings and our committee meetings. I will definitely be talking to Jensina as we get a date for our roadshow kind of board meetings where we come and engage with the community, and we hope to do other things on those days to engage with leaders in the community. I might be asking the Eugene Healthcare Coalition to help find a location. Hint, hint, this is a great one. Yeah, so please just get engaged. Check out our meetings, get engaged with Healthcare for All Oregon, because they are the advocacy organization that got us to where we are now, and that will help us get over the finish line.
Thank you so much, Amy. I was going to say get involved, with Universal Health Plan Governance Board, but I'm going to ask you to get involved with Healthcare for All Oregon, too. I see a lot of red shirts. Raise your hand, local chapter, Lane County. Look at this Lane County chapter. They're on fire. Our #1 sign-up county in Oregon, and this includes Multnomah up there where there's a whole lot of people, Lane County. So, Lou, thank you so much for your leadership and for inviting me here. Healthcare for All Oregon has been doing this work for over 25 years, but it's a people-powered organization, just like most effective movements are. We've got chapters all over the state. We've got committees, finance, communication, membership, nomination, election, legislative. We are largely volunteer-led. We got all of 1.5 staff members and a couple of part-timers. But we are seeing an explosion of growth right now. Since October, we had, for the first time ever, we usually get like a couple signups a week. We had 100 signups at the end of last year, and I know that was partly due to Luigi Mangione and that kind of issue coming up on the floor, but it's also because of the righteous anger that's happening here locally and across the state, and people are just worried about healthcare and know we can do better. So I want you to invite you to go to Healthcare for All Oregon's website. It's HCAO.org, pretty easy to remember, HCAO.org, and sign up. Join the movement, sign a statement of support. If you want to get involved as a member, we'd appreciate that. You can be a member for $30 a year. You can do that $5 a month, cup of coffee. And then check us out on social media. Even if you're not ready, you're like, oh, who are these folks? You want to get involved? We're on Instagram, Facebook, Blue Sky, X, LinkedIn, and more. And TikTok. Watch the TikTok videos. This forum will probably be on TikTok. But please get involved with Healthcare for All Oregon. We can't do the work of moving forward the plan that Amy and the crew are building and get it out and get in front of Oregonians to vote on it without your help. Join Healthcare for All Oregon, HCAO.org. Thank you so much. It's been an honor to be here with all of you today.
Yeah, I want to thank everybody for being on the panel. It was a good time talking about a heavy subject. So I would just say that, what we've been hearing a lot of, we have to collaborate. I think we have to have, we need to organize, collaborate, and then legislate. That's the way that we're going to get somewhere around healthcare for all Oregonians and having a functional healthcare system. Because what we have right now, we're spending an extraordinary amount of money and we're not getting a good result, right? And so we need to have business, labor, providers, patients, everybody come together, acknowledge that it's not working, and then start to look at the path forward so that we can provide competent, quality care for all Oregonians.
I did want to take a minute to answer that question from somebody who called out earlier. I don't know if you're still here, but HB 3227 is Nancy Nathanson's non-disclosure bill, and HB 3225 is her bill for clarifying the physician of care to avoid a straw physician. So I hope that person is still here. So yes, thank you all very much for being here today. Thank you to Healthcare for Oregon and to the EHC for organizing this day, as well as to all the panelists. It was really an honor to participate. And I can't emphasize enough how important it is that you engage with your government at the local level, at the county level. Please don't forget the county level. So often we forget our county. There's some really important work happening there. That's where Eve works. And also at the state level, you can find out more on OLIS, O-L-I-S, which is the Oregon Legislature Information Service. You can go there and look at all of the committees, see what they're working on, see what they're doing, submit testimony, watch committee hearings, and find out information about the bills that are happening. We want to hear from you, and this is a primary goal of my own office, that we want to hear from and engage with constituents. And if you're having a problem, let us know. One of the things that we can do is support constituents when they are having a challenge. Recently, a young man reached out to my office who moved here, a nurse, and he was having a problem getting his nursing license transferred from the previous state he lived in. Happy to say we were able to help him achieve that outcome pretty quickly. So he is now applying for jobs in Oregon. So again, thank you so much, and please engage.
Eugene Healthcare Coalition, there's a QR code on the screen. Feel free to scan that if you would like to get involved and join any of the efforts, get information. The refreshments, the snacks and the bottled waters were donated by HIV Alliance. Coffee was donated by Starbucks, of all places. And so I would be totally remiss if I did not acknowledge the committee that helped put this thing together, particularly the chair of the committee, Eric Jura, who I would have loved to have had up here. He wouldn't wear the pink pantsuit. It was weird. Thank you to Willamette Christian Center for hosting us in this building, giving us the staff to operate the slides and everything else like that. Go forth and be well.